iCAN. My name is Gina Calarco. I work for LabCorp, which is a laboratory services company in the United States, but globally it also has a drug development side where we do sponsored clinical trial work, and that's the side of the company I sit on. I'm a senior director of strategy and planning, and I sit within the rare diseases, advanced therapies, and pediatrics team. So what that means is I help develop operational strategies, how we conduct clinical protocols in pediatric and rare disease populations. My background is I am a pediatric nurse. I began my career in the neonatal intensive care unit. And most of my career has been spent in the pediatric space, and the last almost 20 years within clinical trial work. I will say I also have personally over the last year have joined the land of the unwell, having a cancer diagnosis, and that has contributed greatly to my personal knowledge and layered into the work I do, having experienced such a big illness and treatment pathway that isn't the easiest either. So it kind of plays into how I think about patients in clinical trials. I will never be an expert, end-all be-all expert. I have, which reminds me of some quotes that I have sitting on my desk. One quote came from Carrie Fisher, and it said, "There's no point at which you can say, well, I'm successful now, I might as well take a nap." It just, that's not success. There's always a new bar to go to, a level to go to, a new challenge before me. So I'm constantly having that growth mindset and knowing that I can do better in many ways. I like to, one of the things I value as in myself as a leader is that I like to find solutions and make work easier for us. Sometimes that means a little extra effort up front to educate someone or develop a process or a tool to help navigate a complex situation. But in the long run, it will create more ease and harmonization among the team. So doing a little extra at the front end for ease in the back end, that's something that will never go away. There's always processes that can be improved upon. So I think I can always do better in finding solutions. And they usually rear their head when something isn't working that we thought would work. So as communication is changing, I think I can do a lot better in the virtual realm. I think it's a new area where I need to expand and grow my own skill set as a leader, but also just as a worker in this digital world. COVID also and environmental impacts are really shining a light to me that our work how we work needs to shift more to a virtual realm. And I think I can do much better with embracing the technology that exists and also embracing that it may require looking at how I've worked in the past, how that needs to change. And I don't even know what all needs to change, but clearly our world and our work has changed over the last 2 years and is likely to face more changes with climate change issues coming up and diversity initiatives. It's a constantly changing world, and that doesn't escape the work I do either. And honestly, in the company, the drug development side or a contract research organization, CRO work, we always joke that change is the name of the game. Things are constantly changing. And so doing better to embrace change, adjust to change, open myself up to new ways of doing things is something that I can always do better with.